Welcome back, guys. So many people are getting restless now. They're just wanting the answer fast. Sorry to keep you all waiting. I was engaged in some other thing. So let's discuss the next 15 questions, 166 to 180. Okay. So question number 166 was there was an image which was showing helmet cells, which was showing the helmet cells, and they had asked which condition is associated with this, and then additionally there was history of increased LDH and hemoglobinuria. So the answer for this and the options among the options goiter was there, and I don't remember the other options, but one option was mechanical second heart sound. So this is probably a case of prosthetic heart valve leading to Maha. So in Maha we get this helmet cells, microangiopathic hemolytic anemia may we get this helmet cells. So the answer for this will be mechanical second heart sound. And there was this histology image, and to they asked us to identify what was this structure. So as you can see, this is like the islets of Langerhans cells. This is just the magnified picture of what was given. Okay, so this is the islets of Langerhans cells. Uterus position 2 days following the delivery will be, so uterus position 2 days following the delivery will be two fingers below the umbilicus. Okay, two fingers below the umbilicus. Question 116 was antibody prophylaxis in a child undergoing dental procedure required in. So in this question, basically dental prophylaxis for infective endocarditis is for infective endocarditis we give in conditions like cyanotic congenital heart disease. It's not given for a cyanotic congenital heart disease like ASD, so that will not be the option. The one option was there something like repaired. If it's repaired, it is not required. But if it is unrepaired cyanotic congenital heart disease, we need to give infective endocarditis prophylaxis. So this will be the answer. Question number 170. A patient presents with a history of fever, cough, night sweats for 2 weeks with bilateral hilar lymphadenopathy and features of cranial nerve 7 was involvement was given. So in this question, many people after reading this would have gone for tuberculosis, but along with that, there is history of bilateral hilar lymphadenopathy and features of nerve involvement was there. So the answer for this is sarcoidosis. Sarcoidosis is, we know that it mimics tuberculosis, and many of the sarcoidosis cases are misdiagnosed as TB case. But the clues that was given, I think, is pointing towards sarcoidosis. Question number 171. Additional calories required in pregnancy is the options are like 400 kilocalorie only in second trimester, 300 kilocalorie only in third trimester, 300 kilocalorie throughout the pregnancy. So the best answer for this will be option C, because throughout the pregnancy we require calories, increased calories. But it is best answer is actually 350 kilocalories as required. But in the option it was 300, so that will be the answer. That's the closest one. So 172. The question was a feature of hemolysis was given increased LDH, elevated liver enzymes was there, BP was 140 by 90, thrombocytopenia was there, normal clotting profile, no fibrin degradation product was there. So in this there is very close differential between acute fatal liver pregnancy and health syndrome. But I think the best answer for this will be health syndrome because of increased hemolysis, thrombocytopenia, and elevated liver enzymes. I think the best answer will be health syndrome. Even I am marked AFLP, unfortunately, but most of the people are saying it is health syndrome. So that will be the answer. So question number 173. A girl with intense craving for food followed by purging. Medical findings are normal. Diagnosis will be, so the answer for this is bulimia nervosa, because first thing is there's intense craving, and intense craving followed by purging. This is seen classically in bulimia nervosa, and medical findings are normal. It means BMI is normal, so it cannot be anorexia nervosa. Okay, the answer is bulimia nervosa. Location of most common site of interperitoneal abscess. Okay, so in this question they had for given two images. Basically, they had given two images of liver and the surrounding areas, and they had asked. They are probably talking about the amoebic abscess, but the important thing was for intraperitoneal. So one was in this area, and the other was just below it, and one was in like this area. So this is the bare area of the liver. This cannot be the answer because it's not intraperitoneal. But this part is intraperitoneal, and I think this is the best answer. This is the most common location for the abscess. Question number 175. There was a clinical scenario where a child having ALL had features suggestive of hemolysis syndrome like hyperuricemia, decrease in urine output, increase in potassium, and lymphoblast was seen in peripheral smear. Next best step was a question. So in these options, like we have to give the start the chemotherapy immediately, or we do further investigation or we'll give hydration, or we'll give proven acid. So I think the best option for this is we will first go for hydration, because in any tumor lysis syndrome we need adequate hydration. Then we need adequate hydration, and so that is like the starting thing. We won't directly start with chemotherapy. So I think that's we won't need to do any more investigation. This is an acute condition. First, you have to go for adequate hydration. So we will go for option C. Which of the following causes delay in aging? So this question was there. Exercise daily for 30 minutes, calorie restriction, elimination of hormonal factors. The best answer for this, it was even mentioned in Harper apparently. So the best answer for this will be calorie restriction. Okay, this question was there. Another image-based question: image of dorsal ventral mesogastrium, and identify the asked mark. There was a part that was marked, and it was asked which part is this. What is the derivative of that part? So it's not the exact image, but basically ventral and dorsal mesogastrium was given. Okay, and the questions were asked. And in the option we had linear ligament, we had the gastrosphenic ligament, and we had falciform ligament. So I don't know what exactly. I don't remember what exactly was marked, but the answer for this, because both of this was in the option and both are derivatives from dorsal mesogastrium, so probably they must have asked from ventral mesogastrium, and the answer for that will be falciparum ligament of the liver. Okay, that will be the answer for question 177. Question 175, 178. Urethral trauma question. Image was given which showed extravasation of urine, inability to pass the urine with blood at the meatus. Any injury will be at. Okay, in this also many people are giving different answers, but I think according to what I remember, it was a distal urethral injury and not proximal urethral injury, and so the best answer for this will be the bulbar urethra. Spongy and penile means the same thing. The spongy, the other name for penile. So that these two cannot be the answer. And membranous is proximal. So bulbar will be the answer, I think. Question number 179. On control contraction, if there is bleeding, next step would be. So there was image was given, and next step would be arrange the blood and to create method uterine massage, oxytocin, and manual remove the placenta. So uterine massage and oxytocin we would have already done before in we would have done it in the AMTSL. So the best step to do will be manual removal of the placenta. Question number 180. Okay, so this question was like difficult obviously, because so many options were so similar. So following surgery for vasovaginal fistula, recommended prescription by an intern would be. So there were various options like this, and apparently according to NBCI, the answer is abstinence for 6 months and avoid pregnancy for 1 year for and to allow the wound to heal. So this will be the best answer. Thank you guys. Now the last 20 questions will come. Thanks a lot. Keep on watching the videos and sharing with your friends. Bye bye.